Hello, healthcare colleagues. I'm Tonii Gedin, the Health Officer for Arundel County Department of Health. Measles is one of the most contagious diseases, but it can also be preventable. When our community's vaccination rates remain high, we have the power to stop outbreaks in their tracks and protect our most vulnerable residents, especially infants, pregnant women, and the immunocompromised. This year, the Maryland Department of Health confirmed cases within the Baltimore Metro Area. Because of the historical success of vaccines, many of us have not had to manage a live measles case in our clinic in years, if ever. With the first confirmed cases of 2026, we must restore our collective heightened awareness. Today, I'm asking for your partnership in preventing further spread, beginning with a renewed commitment to on-time vaccination, early detection, and immediate isolation. Let's talk about clinical presentation and immediate actions. We're asking all frontline providers to maintain a high index of suspicion, regardless of vaccination status. Let's look out for patients presenting with clinically compatible symptoms of the following: a fever of 101 degrees Fahrenheit or higher, accompanied by the classic 3 C's: cough, coryza, and conjunctivitis. This is followed by a maculopapular rash that typically begins on the face and spreads downward. Be particularly vigilant when patients who are unvaccinated, immunocompromised, or have recently traveled internationally or to areas with active outbreaks within the United States. If you suspect measles, do not delay clinical management or isolation while waiting for laboratory confirmation. Advise patients to isolate immediately. Remember, this is an airborne virus that can remain infectious in the air for up to 2 hours after the infected person has left an enclosed space. Protect your staff and your other patients the right way. Testing protocols. When testing a suspected case, please follow these exact protocols. Collect a nasopharyngeal or oropharyngeal swab for PCR testing, along with a serum sample for IgM. Avoid testing asymptomatic contacts. To expedite containment, we recommend testing through the Maryland Public Health Laboratory. Results are often much quicker than commercial labs, but this must be approved by the Maryland Department of Health beforehand. You can initiate this approval by calling our team at 410-222-7254 or after hours at 443-481-3140. If state lab testing is not approved, but your suspicion remains high, proceed with commercial laboratory testing. However, if you use a commercial lab, you must notify the Anne Arundel County Department of Health immediately. Again, at our number, 410-222-7254, so we can begin tracking. Reporting and public health response. Once notified, our department immediately launches a case investigation. We track down close contacts to inform them of the exposure, assess their immunity, and identify high-risk individuals, such as infants under 12 months of age, pregnant women, and the immunocompromised. We will also coordinate post-exposure prophylaxis. This means administering the MMR vaccine within 72 hours of exposure, or arranging immunoglobulin therapy within 6 days of exposure. As a reminder, confirmed measles patients must be isolated for 4 full days after the rash onset, with day 0 being the day the rash appeared. Isolation safely ends on day 5. Children must not attend school, childcare, or any community activities during this time. The importance of vaccination. Ultimately, I don't have to tell you that vaccination remains our shield. The MMR vaccine is 97% effective after 2 doses. Asking about immunization status is important for all age groups and your own healthcare staff. These conversations are critical to addressing vaccine hesitancy. This is important as we head into the summer travel months. Ensure children receive their first MMR doses at 12 to 15 months and the second dose at 4 years to 6 years of age. For families traveling internationally or in the United States with areas of outbreaks, remind them that infants aged 6 months through 11 months should receive 1 early dose of MMR vaccine. Adults without proof of immunity need at least 1 dose while high-risk adults, including healthcare workers like ourselves, should have too. For patients 19 and older who may face financial barriers, they might be eligible for free vaccines through the Maryland Vaccine Program at our Department of Health centers. By working together, practicing rapid isolation, and communicating early, we can protect our most vulnerable residents. For continuous clinical updates, visit aahealth.org/measles or call our epidemiology program at 410-222-7254. Thank you for your clinical vigilance, your partnership, and your unwavering dedication to the health of Anne Arundel County.